kinesiologist here at LB Physiotherapy. My role is to work with you to discuss your health goals, expectations, and address any concerns that you may have to collaboratively come up with the right exercise plan for you. I also wanted to introduce you to my co-op student, Sophie. She's a fourth year kinesiology student from Brock University and is hoping to gain a little bit of experience before going out into the field. Is it all right if she sits in on this consultation and helps me ask a couple questions?
Yeah, that's fine. It's nice to meet both of you.
It's great to meet you as well, and thank you very much for allowing me to be part of this conversation. I'm looking forward to working with you.
So today our main goal is to understand where you're currently at with your health and wellness, what you're hoping to achieve from our sessions, and how we can help you get there. We'll be asking a few questions, but we want to ensure that this is a collaborative process, so feel free to jump in, share your thoughts or any questions you might have. Does that sound good?
Yeah, that sounds great. I'm excited to start making changes towards my health.
Your readiness to make some changes is a great start. To start off, can you tell me a little bit about what brought you in here today?
Yeah, well, I'm an emergency room nurse, and my knee pain has been restricting my ability to transfer patients and do other aspects of my job. My doctor also mentioned that my weight could be a contributing factor to the knee pain and that I should increase my exercise, so I guess I'm a little bit concerned about that.
I'm sorry that you're in pain and that it's been affecting your job. I'm hearing that you're taking into consideration what your doctor said to you, which is a great starting point.
Are there any barriers to exercise other than your knee pain that you are currently experiencing? If so, can you share them with us so we can help develop a plan together?
Yeah, there's a couple. It's mostly the fact that I work 3 12-hour shifts a week, and I'm a single mother, so on my days off, I'm busy taking my kids to their extracurriculars.
It sounds like between juggling work and your kids' extracurriculars, it can be challenging to find time for yourself during the day.
Yeah, it's been hard trying to fit exercise into my life. There just aren't enough hours in the day.
Thank you for sharing that. I understand that it can be difficult to find the time, but I hope that together we can find a plan that works for you.
Are there any exercises that you've tried in the past that you enjoyed or would like to try now?
Yeah, actually, before having kids, I used to run a lot and stretch every morning. I really enjoyed doing that. I always felt good about myself and was in the best shape of my life when I was running. But because of my because of my knees, I can't run without any pain. I have also thought about trying resistance training, and I've heard there are many benefits to that. So if I could somehow incorporate that into my week, that would be great.
Absolutely. There are many great benefits to resistance training that I'd be happy to share with you. It sounds like to develop a plan that works best for you, we would want to look at stretching and introducing some resistance training. Does this sound right?
Yeah.
Is there anything else you'd like to add or anything that you'd like to avoid?
I would like to run but right now it's just not an option. I'm also interested in trying a new diet to gain some control over my weight, since my doctor mentioned that this could be an area for concern. Can you offer me any nutrition advice?
It's great that you're looking at this from this lifestyle change from a holistic standpoint. Unfortunately, giving nutrition advice is outside of my scope of practice, but I would be happy to refer you to our nutritionist to discuss changing your diet if that's something that interests you.
Okay, yeah, that would be great.
Fantastic. I'll make sure to set that up for you at the end of our consultation.
So from our conversation so far, it sounds like you have the desire to increase exercise and try to decrease your weight. You've mentioned some exercises that you've enjoyed in the past, and that your job and your chronic knee pain, and then being the sole caretaker of your kids has really been the barriers to increasing your exercise. Have you recently tried to incorporate any of those exercises you mentioned earlier into your lifestyle to positively change your health?
Well, not really. I don't really have the time. I would like to try to improve my health, my lifestyle with exercise, but I just need help starting.
How about we brainstorm together some ways that we could reduce the barriers to exercise?
That works with me.
From what you mentioned earlier, your kids are in extracurricular activities, which seems to be one of the larger limiting factors. What activities do your kids do that maybe you could join in with?
Yeah, well, there's a lot. My youngest is in junior hockey, which I can participate in, but both of my kids do basketball at the community center twice a week, and now that you mention it, there is an adult fitness club at the community center that runs as well.
Fantastic. How would you feel about signing up for this fitness class?
I think that's something that I'd be able to do.
That's great, Kyla. How many times a week would you feel comfortable participating in it at first?
Yeah, my kids are playing basketball two times a week there, so I think I'd be happy with going twice a week, at least to start out.
Your willingness to engage in this class is amazing. It's a great start.
It really is. On a scale of 1 to 10, how confident are you that if you started this fitness class, it would be something that you'd be able to maintain in your weekly schedule?
Maybe a 6.
So what made you pick a 6 rather than a 7 or an 8?
Well, if the class is too intense, I may not be able to do it because of my knee pain.
That's a valid concern. Let's keep brainstorming other ideas that we could do at home.
Okay, as I mentioned, I was interested in doing some resistance training. Could that be something I could do at home?
Absolutely. Even body weight exercises would be a great place for you to start. I can recommend a handful of home body weight fitness videos that kinesiology students like Sophie helped create for our clients with busier lifestyles.
Okay, that would be fantastic. Would we be able to go over some of the benefits of resistance training?
Absolutely. If it's okay, I'll actually get Sophie to answer some of these questions for you.
So first, resistance training is the best way to improve your muscular strength, which would allow you to see benefits in your work and home life. Also, resistance training is great for improving bone and joint health, which would be great for your arthritis you're dealing with in your knees. It's also a great way to improve your mental health and self-esteem.
Well, that all sounds great.
Awesome. Your enthusiasm and readiness to make a change are very admirable. So how often would you feel comfortable doing these home resistance training programs?
Well, if I'm already doing the fitness training at the community center twice a week, I think I would be okay with doing an at-home workout maybe once a week. Is that enough?
Yeah, that's absolutely great. Any additional movement is a fantastic start.
Okay, then let's start with that.
Before wrapping up here, I was hoping to just briefly go over everything we've said and just make sure that we have everything right. Is that okay?
Yeah.
Great. So you're hoping to improve your exercise habits that have kind of been put in the back seat for a while due to your busy life, being a nurse, a single mother, and a single mother. You've also been dealing with some arthritis in your knees, which has led to some pain. You're now ready to start incorporating some exercises into your life and are willing to participate in the adult fitness club at your community center a couple times a week and participate in home resistance training about once a week as well. Does this sound right?
Yeah.
Sorry.
Super sorry. Go ahead.
Sorry, my apologies. Is there anything else that you would like to add?
No, all that sounds right to me.
Amazing. I'm really glad we had this conversation. It sounds like you're in a great place to make some positive change, and we're here to help along the way. As we move forward, we'll check in regularly and adjust things as needed so it feels more manageable for you.
Thank you. I really appreciate both of you taking the time to work with me.
Of course, it's our pleasure. Kyla, if it's all right with you, Sophie's gonna take over for a little bit just to end the consultation.
Sure, that's great.
Great. If you want to follow me, we're going to head into the gym so we can do some initial fitness testing and movement screening to provide you with some baseline information that we can use to our program for your exercises. Is that right? All right?
Yeah, that sounds great.
Awesome. Thank you so much for coming
Thank
today,
you.
Kyla.